So first order of business item, if there's public comment, of course, speak now, forever hold your peace. All right, moving on, we have item 3A. We're supposed to be having a presentation from Black Pflugerville regarding current and ongoing initiatives. Alicia Davis, president of Black Pflugerville, she is suddenly fell ill, so she will not be here, so we'll have to just table that for another time. So with that being said, we'll move on to item 3B, which is a presentation by ESD2 regarding fire safety, populations at risk, and being affected by fire. And I have Nick Perkins, Fire Chief, and also, of course, Daniel. It's not appearing correctly on our agenda, but we'll have that fixed.
Yes. Well, good evening, and we're really happy to be here. We appreciate the invitation to come talk to you all. I did want to take a moment and ask Commissioner Turner to come up and say a few words. We're overseen by 5 board members that are appointed by Travis County Commissioners Court, and Commissioner Turner is one of our board members.
So thank you all for having us tonight. I'm personally really excited to be here. What Dan does and his team is, to me, the best thing that we can do. I know that sounds odd because everyone thinks it's really good that we show up for fires and car crashes and medical problems and everything else. But if we can prevent that stuff, that's the best use of our money. And I think one of the things that I'm really proud of is the work that Dan has done to identify areas in our community that'll benefit the most from those prevention activities. Because obviously, like everybody, we got a budget, we have to live within that budget. But what Dan has done is applied a lot of good analysis work to show us where we spend our money and what kinds of programs we spend our money on that get us the most prevention benefit. And I'm sure has a couple of stories to share, but we have a lot of really good outcomes because of the work that Dan and his team are doing. And obviously, when the firefighters aren't going to calls, they're supporting that as well, smoke detector initiatives, home inspections, all that sort of thing, based on what Dan and his team have identified. But I'm really excited about the fact that they've taken and just not said, oh yeah, we're going to have smoke alarms, come get one. It's like, oh no, this is the part of the community that will benefit the most from smoke alarms. And he'll talk more, I'm sure, about how we got there. And then we go out to those areas and do smoke alarm campaigns, and we've got some great success stories about how we've done it. So thank you all for the opportunity to be here tonight. Like I said, I'm personally, as you can tell, I'm excited about this. As a paramedic, I get really excited about prevention stuff because that's the best thing we can do. Yes, we can take care of folks, we can provide them good response for fires and everything, but we can prevent stuff, that's what it's at. Thank you very much.
Thanks, Commissioner. My name is Nick Perkins. I'm the fire chief. I was appointed about 2 years ago. I began my career here with the fire department in Pflugerville in 1998, so I'm coming up on like 26 years serving in the community. And then this is my trusted confidant, Assistant Chief Dan Berger. We're really excited about Dan. He started his career with the fire department here in Pflugerville. He took a little hiatus to go be a fire marshal for a little county called Travis County, and then he came back in the lead role as the fire marshal for us, and we're just really lucky to have him. So a little bit about Travis County ESD number 2. We are a independent subdivision of the state. We're ESD, Emergency Service District, and we provide fire and emergency medical first response to northeast Travis County. And I'll show you a map to kind of visualize that a little bit better. But we employ 214 firefighters who are all at least emergency medical technicians, and about 60 of them are also paramedics. We cover 77 square miles, and we have an estimated population of about 160,000. We currently operate out of 7 fire stations, 24 hours a day, 7 days a week. And we anticipate opening our 8th fire station off of Weiss Lane in front of Weiss High School no later than January 1st. So we anticipate that to be sooner, but if we've been involved in any construction projects here as of late, it is really hard to get things done on time. And this has been a really long project for us, so we're really excited to get that station open and begin delivering services from there. We also provide a concept called fire-based EMS, which is actual ambulance transport. We used to do that inside the city from 2017 to about 2001, and now we provide it to areas outside the city of Pflugerville. The city of Pflugerville contracts with a for-profit ambulance provider. Our total operating, we still go on all of the calls in the city as first responders, so we're still responding to every single medical call within our district, including the city of Pflugerville. Our total operating budget in FY23 was a little over $40 million, and our current tax rate was at 8 cents. We're currently also in our budget process, and we're looking at potentially adopting a tax rate of 0.077. But again, the commissioners haven't taken official action on that. We're going through that process, and our next meeting is on September 13th. We're also capped at 10 cents, so we can't go over 10 cents. And if you look at your bill, the ESD is just under 5% of your total tax bill. So that's a map of our district. The lime green is going to be the areas outside the city of Pflugerville. So just to kind of help orient you a little bit, this is 130, this is 35. And so this lime green area to the west here is Wells Branch going down Howard Lane. That is City of Austin, ETJ. And then as we look at the lime green area going out to the east, that is the ETJ for the city of Pflugerville. And then kind of the rust color in the middle is the city limits of Pflugerville. So we cover that entire area. So we wanted to talk a little bit about what we think you would be interested in and what you would like to know about what we're doing. Just a little bit of my background. I'm a fourth generation Mexican American. My mom's Mexican. My great grandma came from Chihuahua, Mexico. They really ignited a fire in me for a passion in community public service. My great grandma was the kind of centerpiece of the community that she lived in, and she was an incredible woman that I looked up to, and she really taught me the concept of caring for people, looking out for people, and paying it forward for people. And so I'm really proud of what our fire department has done for a really long time, but I've been really privileged to be in a position to watch some really neat things happen in the last couple of years. And so some highlights on the topic of diversity in the fire department. It's something that as a service we have not done a good job of. The fire service is primarily white and male. And so lots of reasons of why that has transpired. But as of late, there's been a lot of work in the fire service leadership around the country, certainly here locally, to change that. And so when we look at the national statistics for career female firefighters, it's about 5%. It's 11% total, but there's volunteers included in there, and then there's wildland only included in there. And that number brings it up to about 11. But if we just look at what applies to us, which is a career structural urban fire department, it's 5%. And so in the last 4 years, we're almost triple the national average at 13%. We have another class starting on Monday, and that number is going to raise after Monday as well. And so the other statistic is that we're 36% of our workforce come from underrepresented backgrounds. And so again, we follow the local data, so we know every breakdown of the race and ethnicity in the community matched to our internal demographics, and we work really hard to focus recruiting efforts on that. If you're following what's been going on in our state, the governor's making it really difficult to do really aggressive DEI initiatives. We were looking at implementing some pretty aggressive initiatives, and our legal said, well, hold up. This has gotten a little bit more difficult to do. So, but nevertheless, the biggest, greatest kind of thing that we've done to allow this to happen is we went to a civilian hiring program. So traditionally, if you wanted to be a firefighter EMT, which the state requires you, if you want to be a firefighter, you also have to be an EMT. You had to pay for all that training, you had to do that training on your own. And that takes about a year. It takes about a semester, which it's a semester going every single day, Monday through Friday, 8 to 5. For the fire side, and then the same thing on the EMT side. So very few people can do that and hold down a full-time job, pay mortgages and things like that. And if you have kids, there's no way that's happening. So, or it's very difficult to do that. So what we saw really happening specifically in Central Texas, and it's happening across the country, is we're seeing less people wanting to get into this business. And then here locally, we saw a population explosion. And so the demand for the services went up. There was no change to the colleges and the outputs of the current workforce. And so every single fire department had vacancies with not enough people to fill positions. So we pivoted very quickly, and because of some work that we had started with the high school, by working with the high school to offer fire EMT certifications in the high schools, we've been doing that for about a little over 4 years now, right now. We had all of the components in place to do our own internal training. So we then pivoted and went to a civilian hiring program, which meant that we would hire you, we would train you, and we would pay you while you were doing it. And that brought our diversity numbers from a very, very narrow margin, we were essentially having to select from people who selected the job to being able to recruit directly from the community. And so that is what's allowed us to make really, really big gains. We're one of the most diverse departments in Travis County. And again, myself and Chief Baker are the only fire chiefs who come from underrepresented backgrounds out of 14 fire chiefs. There's just 2 of us. So again, we're really proud of this. This is a big deal. The 36% will be over 40% on Monday as well. We're still getting that data. Again, we can't compel people, so a lot of this is we try to talk to them about what we're trying to do and help us with this information so we can have really accurate data. And I have about 11% of my total workforce now that I don't know. They have not shared that information yet. The last thing I'll mention on this is I've just left Pfluger Hall. There's over 150 people there right now. If we get out of here in time, I'd recommend we go over there because it's a pretty cool site. So we have both fire and EMT high school students along with all their parents. So that Pfluger Hall is completely filled with people, and we're going over these programs and talking about the opportunities, the pipeline that has essentially been set for someone who can essentially have a pretty high-paying job in as little as 6 months once they get out of high school. So it's a really big deal. It's an incredible opportunity. We're really proud of it, and we're really grateful to the school district for the efforts that they've done. PCDC has contributed a lot of money to helping us get equipment. If you didn't see here lately, the latest grant that the school district was able to receive funding for through PCDC, we were able to buy an ambulance. And so the students now have access to an ambulance to learn and practice their skills. So this is the really exciting part of what we're going to talk about tonight, and I'll turn it over to Dan unless you have any questions for me. But there's an old saying, and it's that an ounce of prevention is worth a pound of cure. And so a lot of what, when we talk about fire prevention, nowadays we call risk reduction. We're trying really, really hard to obviously impact people's lives by reducing suffering, saving lives. But there's an economic component for everyone as well. And so we know through empirical research that for every dollar that we invest in prevention, we'll see about a $2 return in prevention, so a return on investment. And so Dan will go over this program from kind of start to finish, and we'll show from the investment component to the return. And again, it's something we're really proud of. And again, we really appreciate the opportunity. So I'm going to turn it over to Dan, and then I'll come in and talk a little bit of wildfire. Thank you, Chief.
Okay.
Question?
No, it's not so much a question, but a comment. I wanted to thank you for sharing your heritage and acknowledging that maternal influence and what that influence had on you. I think it's super important for people to hear, like, what you took away from that heritage and that brings to your role in the community. So
Yeah, it's
just
very
thank you.
strong women in my life. There's no question.
Awesome. That's all.
Maybe a little too strong at times?
Yeah.
Yeah. Hey guys, thank you so much for having us. As Chief said, my name is Dan Berger. I'm the Assistant Chief of Risk Reduction for TCSD2, Louisville Fire Department. I've kind of gone over this topic and presentation several times, and in fact I've redone this like 4 or 5 times today. So this will be the first time I've seen it fully. So this is great. We get to see it the first time together. So I serve in what is traditionally called the fire marshal role. We've pivoted recently, I say recently within the past, I don't know, 5, 8 years from the risk reduction model, as Chief Horgan said, from the fire prevention model to a risk reduction model. And all that is in general is being a little bit more proactive and studying and knowing your community a little bit better so that you can serve them better, right? So I think it's an acknowledgement that our district, that Chief showed you earlier, is different than ESD 6 by Lake Travis, different than ESD 11 down by the airport. And so the idea that you can understand your community better to serve them better is kind of the core principle of what we're doing in our office. So I'll get into our risk reduction programming. Our section also does fire code enforcement. We are the fire marshal services for the city of Pflugerville by contract. That means we have a team of plan reviewers. Every new building, which there are a ton of them here, every new building built in Pflugerville is reviewed by their team, the city's team of planners, engineers, zoning, building officials to make sure that it meets certain building requirements, plumbing, mechanical, electric, and then we get to do the fire and life safety component. So we get to make sure that rooms of this size, if they require it, they have sprinkler systems. They're covered with those little concealers, those little things, those are sprinkler heads. Reaches a certain temperature, those things pop off, sprinklers come down, water flows. Make sure we have enough doors, exits, they swing the right way. Make sure people can get out in general while our firefighters get in, and make sure that they can operate in a safe environment. So that's in general what we do with the fire code. And then of course we do public education outreach campaigns, which are kind of under the umbrella of this, our community risk reduction program. So I always like to start with this slide because people are like, man, community risk reduction, that's a mouthful. You know, what is that? And to me, you know, what's in a name? It's everything. Know your community, know the risks specific to them, and then write programs to reduce those risks. So this is the interactive part. To you guys, what makes up a community? And there are no wrong answers to that. I promise you will fall in one category. But what makes a community up?
Citizens.
People. People. Yep. Know your demographics, know your people. Absolutely.
It's businesses and
Yep.
organizations.
Economics.
Mhm.
Yep. Organizations. How about buildings? City of Orlando, half the population lives vertical.
Yeah.
We have high-rise, residential structures, many of them unsprinklered. If we had that, that would be, focus area. We don't have anything like that. So knowing your buildings, knowing your economics, knowing the people you serve, knowing the geographical hazards, knowing the man-made hazards. So all these things kind of are interwoven and meshed to make our local community. So the cornerstone of our programs are these 3 documents. I'll go over them briefly because people tend to glaze over when I get nerdy and talk about this stuff. I realize that everybody's as passionate about this stuff as I am. But the cornerstone of what we do is we're CRA, and it's up here. CRA just stands for Community Risk Assessment. That's the document that says who's in our community and what are those risk factors that we just described. And I'll go over, in general, some of those things here. So basically, the risk assessment is the community aspect and identifying the risks. The middle document is the risk reduction plan, and it takes those risks identified in the risk assessment and says, hey, cool, so what are we going to do about them? And then finally, the evaluation piece says, okay, how did we do in meeting our goals? So one of the key things here is, and I think this is one of the core fundamental differences between prevention and risk reduction. If I can make an analogy, prevention, right, is going to Home Depot and passing out stickers or plastic helmets to the kids. And that's fun, and that's cool, and it builds goodwill, and the kids love it, the people love it. But how does that change behavior? How does that make our community safer? So that can be a thing, that just can't be the thing. So this is a strategic look into our community, writing programs to benefit them, measuring those programs, and then reevaluating. So in firefighter speak, what's the problem? What are we going to do about it? How did we do it? And this doesn't end. This is cyclical. So these 3 documents live now. We're currently wrapped up with our evaluation piece. We wrote our new CRA. We're writing our new CRP, our new plan to see what we're going to do. And of course, when we're done with our 5-year study period, we're going to say, cool, how do we do in meeting those goals? So I'm going to highlight a little bit of our risk assessment now. So to understand our community, we kind of had that interactive exercise where we said what's in the community. The guiding document of this, we didn't make this up, by the way. This is done by the National Fire Protection Association. They're like the bee's knees for how we operate. They tell us how our trucks should operate, what kind of gear we have, how you investigate fires, safety at gas stations. They do everything. So we didn't make this up. We're just following the national standard. We just do it really well. So the NFPA says to understand your community, you should understand these profiles. The demographic profile we're going to dive deeply into. So we looked at the demographics of the people, right? Our economic profile, forgive me, this is a little outdated. Those numbers have changed, those employers have changed, but we did look at the economics. What industries do we have, what employers do we have, and also include our community events. We recognize that community events, Deutsche Fest. For example, our open houses, just anything that draws community in and that makes people feel like interwoven into the various organizations is a big part of our community. So we also looked at the hazard profile, which is our man-made or natural hazards. It's a little bit blurry, forgive me for that. That's a map of our Tier 2 occupancies. Tier 2 is a nerdy way of saying hazardous material businesses. So we have 42 hazmat buildings in our district, many of them within the city of Pflugerville. And one of the challenges we noticed through this study is that many of those existed or were built kind of out in the boonies or out in the farmlands way back in the day. But as Pflugerville has blown up and as this region has blown up, the neighborhoods have encroached on those hazmat buildings. So we certainly wanted to get a hold of that, inspect them, and make sure they're safe enough to fire code so we don't have a hazmat incident. We also looked at our response profile. That's the fun stuff. What type of calls are we responding to? All of them, EMS calls and fire calls. To look for trends, look for clusters, see if they're happening in certain locations, and certainly looking at the numbers to see kind of like what are we doing more of. I mentioned the building stock profile, the example about the high-rise structures. We want to know what type of buildings predominantly make up our jurisdiction, because that has an impact on how we respond on the fire side. And if I had some better colors, this is a really cool map. There's a lot going on. We actually use this in the example. We're going to look at this process through the lens of the smoke alarm program. We use this big time because this helped us identify homes that were over 10 years old. Did you guys know that smoke alarms expire? Yeah, you didn't. So yeah, not many people know that. I didn't know that. I learned through this process. Yeah, they expire after 10 years. So oftentimes when they chirp at night at 3 a.m., they're saying, "Hey, my sensor's no longer working. I'm not going to alert you guys when there's a fire." So, at any rate, we use this to identify neighborhoods and see which ones predate modern codes and which ones are only 10 years old. And then finally, my favorite. Fires, what type of fire, we're a fire department. It is one of our core missions to respond to fires, to mitigate fire hazards, and to reduce the risks to our occupants and our residents from fire. So we looked at all different fire aspects, again, causation, clusters, numbers, etc. This is just an example of some of the data we looked at. Down here on the bottom right, we run a lot of cooking fires. Imagine that. Every fire department in the country responds to a lot of cooking fires. Have you had a cooking fire?
Well, it's usually just smoke.
Yeah.
Yeah.
Your
No
smoke alarms
actual-
go off?
Yes, they do, and I, walk around like a crazy woman, opening doors.
See, that was a trick question. I just want to make sure you had smoke alarms. That's
Yes. What period of, like, the response, that data, what
Yeah, so
period
this
of
is
time?
from 2000 and, let's see if I have it up here. So we wrote this in 2018. I think that's 2013 to 2018 or 2012 to 2017. The newer CRA covers the gap, so we're not missing any years of data. Okay, good question. All right, so once we look at all of those different profiles, these are the areas we chose to focus our efforts on. We'd love to work on, car seat installations, and wildland mitigation, which we certainly would like to be doing a lot more of now. This is a funny season, we were talking about it earlier. But these are the areas we selected based on the data. And I'll tell you why here in a second. For each one, falls. We run a program on fall reduction. Falls are almost our top, I think it's the top 3 call type. We run a lot of falls. And falls are the second leading cause of death in our area. Kind of weird to say, kind of weird to even acknowledge, but what happens with the fall is in an elderly patient, they fall, perhaps break a leg, break a hip, go to the hospital, catch pneumonia, never make it out, and pass away in the hospital. Ultimately, the contributing factor to the death was the fall.
What's what?
Pardon me?
What's firstly?
I believe it was cardiac related.
Yeah, natural is cardiac, and just here recently for non-disease related was ODs. So for the first time in 10 years, ODs overtook falls.
So it's number 2 now, right now?
Falls is, yes. ODs is still number 1.
Oh.
In all of Travis County. For our
Oh,
district
okay.
specifically, we don't have that density we were talking about earlier of overdoses.
Mhm.
We still see falls as our leading.
Yeah, and some of this, I should acknowledge, we didn't select our number 1 call type or even our top 5 call types. That would be very natural. We'll just take your top 5 calls and then, work right programs to reduce those. But one of our top 5 call types was sick patient. So what are you going to do? How are you going to reduce the number of sick patients?
The Tylenol.
Right. It's just an acknowledgement that, hey, you got to think about the probability of it happening, the impact if it does happen, and almost as importantly as those two is our capacity to change. What's our capacity to change? And for some of these, we just didn't feel like we had enough staff, time, resources, energy to really affect the overall problem. So falls, cooking fires, I mentioned number 1 fire type. Fires are part of our core mission, fire response, fire prevention. So we run a program to reduce the number of cooking fires in our jurisdiction. Large scale incidents, it's a fancy way of saying active shooter, hostile event, whatever you want to call it, these soft targets. We have a growing number of buildings, businesses, and soft targets for a potential hostile event. We wanted to make sure our programs, our response was shored up, so in the event of an incident, we were ready. And then also event planning. I mentioned the multiple events that are going on here, Slice of Pflugerville, Deutsche Fest. It's going on and on. The area is really blowing up with events. I think it's great. Pride was a big one. I think over 8,000 people. The same with Slice of Pflugerville. So we wanted to make sure our event planning was great so we can continue these events and make sure that they're well attended and safe for everybody.
Maybe not use blowing up.
Thank you. I'll be careful with my terminology. Tier 2 facilities, I mentioned, that was a danger for us, those hazmat facilities. So we wrote a program, inspection program, code enforcement program to make sure that they were up to code. Fire alarm activations. How boring is that, right? I agree, it doesn't really move the needle at face value, but fire alarm activations kind of drive me nuts, and I'll briefly explain. They're one of our most common call types. We're requiring these businesses to put these fire alarm systems in their building. And because they're not maintained appropriately, they're alerting our crews to respond to a malfunctioning alarm that's not being maintained. So guess what happens? Our crews are pulled out of the station to go to a false alarm that's not maintained by the property owner. And then your mom, your son, your daughter, your husband, your wife has a motor vehicle accident, a cardiac event, a stroke. And we can't get there for a first unit because we're messing around with the fire alarm system because somebody was negligent. I hate that. So we worked with a program to reduce the number of false alarms in our jurisdictions, to keep our fire engines in-house to respond to higher priority calls. Yeah.
Are there financial penalties for that? Because I know whenever there's talk about ESD services and the tax rate, there's usually somebody with uproar about
Yeah,
the public financing.
sure.
So that sounds like it's taking resources and money, and are there penalties, or can there be?
We call them economic incentives. There are typically 5 E's to reduce the risks that I'm mentioning here: economic incentive, engineering, education, emergency response. So yes, we now penalize those. So we say, look, we understand that false alarms happen. We certainly want you to have alarm systems in your building. They're required by fire code, but if you don't maintain them, we're gonna give you a chance to fix it. In fact, we're gonna give you 3 chances in a year. And if it's not fixed after 3, we're gonna bill you $400. And this is for commercial, we don't send anything to single-family residential, but we run a lot of those as well. That's for commercial occupancies. After your 4th one, it's $500, and it continues for a rolling 12-month period. And we have seen great results from that. We have reduced, since the implementation of the economic incentive program, we've reduced false alarms by 20%. So it's been effective so far. Now we'll see if that continues, because guess what? I think in the past 18 months we've put in several hundred systems, new fire alarm systems, each one that has several hundred initiation and notification devices associated with them that can fail. So all the little blinky things, when those fail, it sends a signal to the fire alarm panel, we respond. So there's more opportunity to have them, so we'll see how this goes.
And there's no talk of, why 3? I don't know, 3 seems like a lot of chances.
Yeah. Well, we're part of this. I agree. This it's an arbitrary number. We're trying to balance being overbearing too. We understand that it costs a lot to maintain these systems. It costs a lot to put them in.
Yeah.
3 is a lot. I agree with you.
It's shifting the cost to the public. And they are a business after all. So
Yeah.
that's just my 2 cents on that.
Understood. No, it's good feedback. The bottom line is it's effective so far. If we need to monitor, we sure have the legal justification to do it. I think we've got the data to back it up to say maybe we should ramp it up and put the customer, not the public, but the one responsible on the hook.
So just to clarify, the fines kick in, you said after like false alarms only?
Yeah, it's false alarms. So we don't bill for what we call non-hostile smoke. So if in a break room somebody's cooking popcorn here at the library, and the smoke alarm initiates, or the fire alarm system initiates because it senses smoke. That system's doing exactly what it does. We have a human error issue. So that's where we can get that data and start educating. Like, hey guys, remember, cook popcorn, don't put it in there for 5 minutes, stay in the kitchen. And we're actually doing that. So we only bill for the malfunctioning devices. So when our crews show up, and they go to the fire alarm panel, and how those work in general is that it'll give you a readout of what devices failed and a description of where. So they go down to the hallway, they go to the device, and I don't see any smoke, I don't smell any smoke, get their thermal imaging cameras out, I don't see any smoke through the walls or in the attic space. This is just a malfunctioning device. Because those, our smoke alarms in our home, they fail over time. Sometimes they're put in incorrectly. Sometimes they're put in with the wrong gauge wire. Sometimes they're incorrectly attached to each other. So they fail for a number of different reasons, but at the end of the day, it's the business owner that's responsible for maintaining it.
So how would they maintain a system like that? And is it universal, or is there different kinds of it?
So through the city's fire code, there is a requirement that says if you have a commercial fire alarm system, so if any of your business owners, or I don't know if you got a panel here, I'm sure. You're required to have them inspected annually by an ITM company, inspection, testing, and maintenance company. They have to be licensed by the state to do that work. They come out, they run some tests on it, some continuity tests, blow some smoke in smoke detectors, and make sure it's alerted when it should. What happens over time in a growing jurisdiction like ours is we lose track of where those systems are, and even though we'd love to be the ones that hold people accountable, it's not our responsibility. It's the building and the business owner's responsibility. So. Hey, this is good. I didn't know you were being a false alarm. This is great.
Oh, so once they, I guess they certify and they test it, do they get a certificate or a license saying
That's the
oh,
stuff you see posted.
Yeah.
Yeah, so on the
Make sure.
fire alarm, you'll see a sticker, and there are different color stickers. Yellow, red is bad. A red tag means the system's out of service. So if the system's out of service, there are certain fire code requirements that kick in. And then, there's a yellow tag for maintenance, a white tag, a blue tag. And so when we go up as an inspector, or if we're just walking through and we see one of the warning tags, or the bad ones, we know that we've got to make a stop and say, hey, you need to get this repaired. You want to talk about this some more? I can, because I'm going to do it. So check it out.
We
also
see the
have-
light in your eye.
I don't know, how long do y'all typically go here?
it ranges?
All right, so we also have a system in place now those ITM companies, they are required by law to send us those reports. But what was happening is they'd send it fax, they'd send it email, they'd send it snail mail, they'd send it to the wrong place, they'd send it to PD, and we never found out about it. And so there was a problem with communication and coordination with us and the ITM companies for us to even be notified that there's a problem. So we contracted with the third-party vendor, and that vendor works on our behalf. It's a cloud-based system and a cloud-based software. So all those ITM companies, every single report for every single building in our jurisdiction now has to submit those reports to the portal. And I can get on there right now and show you every single fire alarm system, fire sprinkler system, and kitchen hood system in the jurisdiction and what status it's in. So now we're notified right away of a red tag or yellow tag. It's really cool. And it's the best thing is it's free.
I was gonna say, and
Yeah.
who pays for that?
No, it's free.
So,
Well, we don't pay for it. The fire department doesn't pay for it. Certainly the citizens don't pay for it. The ITM companies charge $15 for every report to the building owner. So they take the money from as part of the service they provide.
so you said that the city requires like an annual inspection.
Yeah.
Like as far as you know, does the city like? Is there any way that they enforce that at all? Or
Absolutely.
Like, how do they
So
do that?
I mentioned that our section, our division, we are the city's fire marshal services by contract.
Mhm.
And so the city has adopted several sets of development codes, including the building code, the plumbing code, the existing building code, all kinds of stuff. The fire code is done by our section. And so in that fire code and in the city's code of ordinances, it describes our relationship and our authority. So we have the authority to go bill them, to write them citations. But what we do is we have a good partnership with the building official, Robert Polanco, and the code enforcement team, Manny Villegas with the city. If we ever have an issue, we write a nasty letter. Better do it, come on, or else you're going to be fined, it's going to be a headache. And if they don't comply, then we go take it to the building official and Manny Villegas, and we go through the rest of the process. Good questions.
Have you ever I guess is it generally have you seen like many problems with people just simply not doing what they're like? Have you had to contact building
Yeah.
building officials?
Yeah,
for
you'd
that?
be surprised. I think for the most part, there's like an educational component to it. Like, hey, here's why we're doing it. We had a rash of these. This is wasteful. This is inefficient. You're taking us from higher priority calls, and you're costing us a lot of money to respond to these. And by and large, everybody's like, cool, we'll get it done. I'm sorry. There are a few people that just don't care. And, that's happened for sure. And like I said, we work with Robert and Manny very well, and we haven't had an issue. We haven't had to take anybody to court yet. So it's going well. And I will say also that it's kind of in its infancy. We're only in the third year of this, so the big, large-scale data, we don't have that. And we're still working through clunky processes of people not paying their bills, of return addresses, right? Like we send in certified mail, sometimes we get a kickback. It's kind of a headache to administer this program, but we think it's going well.
Thank you.
Yeah, sure. Any other questions? Cool. Yeah, and this is totally casual, and I'll just ask questions as we proceed, please. So, smoke alarms. We're going to talk about smoke alarms now, and I think it's very easy for me to get pretty passionate about this. I'll show you some statistics later on. But we have an aging population. We have older homes in the jurisdiction, and we just have a need to get out there and get in the community and make sure everybody's smoke alarms are working. And I'll walk you through that and the justification here through the lens of our demographic profile. And again, this is the demographic profile from that risk assessment. So I think we need to start with this. Fire is a bit of a bastard, and that it doesn't treat everybody equally. There are different groups that are impacted differently at greater rates. And in general, it's the very old, non-English speaking, African Americans, those living in poverty. And we used to say the very young. That was in like the 70s and 80s. There was a rash, and the death rate for 10 and under was insane. And it was largely due to flammable clothing, flammable bedding. And do you guys know one of the engineering components that was improved? So from a risk reduction mindset, you've got kids that are playing with matches and playing with lighters, and their clothes are ignitable, their bedding's ignitable. One engineering marvel just started changing the death rate, as well as some educational things. But one engineering component was the child-proof lighters. When those came out, we saw a decrease in the death rates in that age group. So that's an example of this risk reduction mindset. This is an engineering component to help reduce those risks for that age group. So now we don't say they're very young anymore. Unfortunately, the death rate in older populations, and all of the data says older populations is 65 and older. In general, as you get older, and in the 80s, 85, 85 and 90, that death rate increases. But 65 and up is what this data is talking about. So, this is not causation. I want to be clear about that. This is correlation. Okay? And where you see multiple risk factors in place and layered, you have an increased risk, right? So, acknowledging that, we wanted to dive into our demographic data, and in case there are any data nerds, this is from the ESRI, this is from the Environmental Systems Research Institute, and the most recent US Census data. So I mentioned fire affecting different races and ethnicities at different rates. On the left there, backs up that information. In a study of US experience with fire, the NFPA released this data. And so this is from 2015 to 2019, they examined every single fire that was reported, all the fire deaths, and they found that African Americans had a 14.2 death rate, that's per 1 million population. I want to call out Native American or Alaskan non-Hispanic, that's the highest among all ethnicities and races. We just don't have a large population here. But I do want to call it out as being the highest. And then at the bottom, the death rate for all races and ethnicities combined is 10 per 1 million from that time period study. So that just kind of backs it up. And then on the right, just an example of some of the data we looked at for our entire jurisdiction. Race and ethnicity combined, white 40%, Hispanic 32%, black 15%, Asian 9%, and mixed other non-reported 2%. I mentioned older adults. This is a map showing density of those 65 up. So our population of this at-risk age group is 12,000, a little over 12,000, and the report that we have acknowledges that older adults are more likely to have chronic illness, more likely to be alone, more likely to have a fixed income, and have some sort of functional limitation, whether it be cognitive, physical, whatever. So as you can see, it's kind of evenly dispersed. If you're just looking at colors, like that dark blue color is the higher density. But from a raw numbers perspective, let's see if this little guy's working. You see this little guy right here, in between 680 or 685 and Railroad. That's more densely populated than this area out here. So while it's 25% of that total population of this parcel, the raw numbers are. This just means there's more people here that fall into that risk group. Does that make sense? Mm-hmm. Okay. So in our demographic study, we also looked at our community members that have a disability, and we defined it through, as the ADA defines it, physical or mental impairment that substantially limits one or more major life activity. Almost 9,000 households with at least one individual with at least one disability, and this shows you kind of a clustering effect and density effect. The red are the higher concentration. They're not full parcels, these are blocks. So we examined that in relation to our risks and our low income. I mentioned the impacts of poverty. And I think it's really interesting, we have just 3,200 people that are 3,200 households, not people. We're like 3.5 per household, if you do math on people. But the reason, there's actually several studies opine that there's a correlation of those living in poverty and fire risk are those factors there. So instead of buying smoke alarms, investing in fire and life safety systems. Those living in poverty are more focused on dealing with substandard housing, overcrowding, food insecurities, and neighborhood safety. So fire safety is kind of pushed to the back burner, so to speak.
What is that street?
Where
Like,
you-
I'm looking at that bottom corner, dark blue.
This would be, I guess that's Palmer, right?
That's a Jaeger Lane area.
Oh, okay, that's Jaeger. Yeah, it's kind of garbled on the map, and the map's kind of big picture, but that's the southern, like the most southern portion of our jurisdiction, right by the city of Austin, outside the city limits, and the unincorporated portion of Travis County. Sorry for the coloring. There's some deviation there that shows up a little bit nicer on the screen. I mentioned the impact of language. Again, not causation, correlation. Some, again, studies have suggested that the impact of just getting people there quickly and mitigating it, doing a quick patient assessment during an emergency is limited in impact if we're not speaking the same language. So this is a lot of information that's interesting, but I think for me, the key thing is that over 7,000 people in our district don't speak English well and don't speak English. So we use this information to go out to neighborhoods in the entire jurisdiction. And instead of saying, hey, look, guys, we got free smoke alarms, come meet us here at the Home Depot, at the HEB, and pick up free smoke alarms, you know what people are going to do? Either not pick them up or it's going to sit in their car. I get it. Everybody's busy. Everybody's just got a million things going on, and nobody's really worried about smoke alarms. So we went out and targeted areas using this data, layering this to say, look, all right, if you've got a higher concentration of these risk factors, or if we've got multiple risk factors in place, we want to go install smoke alarms. We did this through a winter storm. We did this through a pandemic. We did this through another winter storm. We did it through the summer. We did it through the winter. Like, I'm so incredibly proud of our operations. This at first was going to be initiated and pushed out with us using faith-based organizations, nonprofits, volunteer organizations that were going to go out and do the installations. Guess what happened? COVID hits. Not doing anything. Nobody wants to volunteer with us. Nobody wants to go out. We certainly don't want to interact with the public. Our firefighters, our guys and gals stepped up and said, we'll do it. So you see colleague Tim there on the left with the mask on. We did it through COVID. So also offered some, this is a deaf and hard of hearing family. We targeted our deaf and hard of hearing community because they are at an increased risk of fire death. And the problem with these devices is that they're incredibly expensive. These are $200 to $400 devices. So it's like a little bed shaker, and this bed shaker sits right by the bed. The smoke alarm goes off. The bed shaker senses the audible smoke alarm alerting, and there's a little device attached to the bed shaker, and it's put under the pillow, and it shakes the pillow until they wake up. The strobes, kind of like you see in a commercial fire alarm, like that. That's a strobe. That's a strobe. Strobes are very expensive, but we were able to partner with some incredible organizations, including ADRN, including the Red Cross. We got these free for us. We just had to provide the man hours, which is great. So anyways, incredibly impactful. I want to show you just kind of the level we went to. Again, this is a lot of numbers, a lot of data. I love this stuff. We looked at every single parcel of our jurisdiction, and you can, it's not parcel, tract, excuse me. These are census tracts. And we laid it all out. Where do we have increased risks? Where do we have multiple layered risks together? And that's how we selected where we were going to go. It wasn't haphazard. It was very specific. It was very intentional. And I'm just, like I said, tickled that it's going the way that it is. So I want to give you an idea of where we've been. Again, my apologies for the map. You can kind of see our blue district outline there in light blue. Those areas in red were ones that we identified that have those number of risks. With old homes, with an aging population, or living in poverty, or non-English speaking, or multiple living all together in that same area. Go out, go door to door. We have a data system in place where our crews go out, identify the address, and knock on the door. If they don't answer, we just notate they didn't answer. we go back a second time. So we offer this service 2 times to every single home within those jurisdictions, or within those boxes, trying to install smoke alarms. And so the impacts, you can see the numbers. I'm not going to read them to you. We're making a difference for a lot of people in specific target areas. And everything has a cost. And this is a 4-year project, so there is a cost associated with it. It has cost $400,000 of federal money. We have put in for 3 grants for this. This has not cost the district anything. We do have some accessory costs, excuse me. We're responsible for 5% of the total grant, so we've got to match 5%. So in 4 years, I think we spent about $20,000 of our money for this initiative. So full transparency, some of it is ours. However, most of it is federal grants. And federal grants are not easy to get, and they're not easy to manage. You have to do a lot of documentation. There's a lot of paperwork involved. It is incredibly time consuming, but we also think that it's incredibly worth it.
Who does that paperwork?
It's a team. Our accounting department has several members that are kind of monitoring this. We have a lead grant kind of administrator. Our accounting director has oversight of the application. Myself and my colleague Casey, we do all the tracking of the alarms because we have to account for all of the alarms purchased. So all of those alarms, they all have to be accounted for. If we have extra, we have to say what we're doing with them. So there, to answer your question directly, sorry, there are several people from several different divisions.
And those accounting people, those are employees of the ESD?
Yes, ma'am.
Okay.
Yes, ma'am.
I'm an accountant, so I get
Oh, cool.
especially curious about accounting.
Yeah.
I used to
be. We can talk numbers all day. But,
I used to be fair.
So I just want to share with you briefly, this program has been incredible for getting us in front of people, to have conversations with people that are historically underserved or at higher risk, and we get to speak with them and talk to them and get to know them in a non-emergent environment. Most of the time if we see you, it's going to be rushed and we'll treat you kindly, but it's business mode. This is a little more slow-paced. We're going to ask you about your pictures, we're going to pet your dog, we'll just get to know you. That's been incredibly valuable to get to know our community and interact with them in a way that's different from what we typically do. But it's also had some impacts on some saves. I'll share one with you. It was Christmas in like 2021 or 2020, I don't remember. They all went together, forgive me. We had just installed smoke alarms in a home that didn't have them 2 weeks prior. It was right before Christmas time. Family of 5 sleeping, dog sleeping. In the early morning hours, there's a fire that happens in the underskirting of this mobile home, manufactured home. Fire gets up into the home. Everybody's still sleeping. The smoke alarm that we just installed 2 weeks prior alerts. Everybody gets out. The pet gets out. 2 weeks later, they're having Christmas in their home. That's, to me, that's a win. Like if we stop now, I'd be good to go. That's where there's a little 9-year-old girl there. They were all Spanish speakers. It was awesome. We had another one recently in a duplex, not near as cool of a story, but the homeowner was alerted by smoke alarms that they just put in. That one was far more damaging, unfortunately. It was in a duplex, and the side where the fire originated, they did not have smoke alarms. We went back and looked at the data. Nobody answered the door. 2 of our attempts to knock. Not that I'm saying it would have made a difference in the outcome. It could have, but unfortunately, that was a larger loss. But regardless, those alarms alerted and did what they were supposed to do. So those are the known ones. There's data out there to suggest that there are a number of unreported fires. So think that you have a small fire in your kitchen, or in your bathroom, more likely it's in your kitchen, and you just handle it yourselves. That happens. A lot of people like to try to fix it themselves. Do you know the number? Do you know the data on unreported fires?
Nothing to know from you.
Sorry to put you on the spot. It's staggering. I want to say it's like in the several million estimated. And this is just based on surveys, right? So how do you count something that's not reported? Right?
Most of the time we talk to groups though, and everyone has a story of how their house was burned down.
I
Yeah, so anyways, it's in the several million. So my point as it pertains to this is that we know these 2 success stories. We think there are probably a number of others out there where those alarms have alerted appropriately. We just don't know. So.
Mine was my, where I grew up, we were in a rural area. And it was probably this time of year, and it was like, I don't know, my father thought it was a good idea to like burn some trash or something stupid. And it started getting out of control, and so we got home to see him connecting wire hoses to try to, yeah, bad.
Is that recording? I won't tell you the story. We'll talk offline.
Okay, okay.
Not too long ago.
All right.
Yeah, it's pretty similar. At any rate, so I just want to share this with you to kind of back up why we're doing what we're doing. This was a blurry slide to begin with. This was just the best one I could find. This is from, I mentioned NFPA several times. They have a comprehensive report of home fire incidents, and man, it's just a fantastic report that kind of gives us a big snapshot of what's going on with the U.S. home fire situation and fire death situation. So what's happening is, since the 1980, fire professionals and officials have done a really good job of reducing home fires, just the number of home fires. That's the advent of smoke alarms, improved codes, improved code enforcement.
May I have your attention, please? The library will close in 30 minutes. The computers and the printer will shut down in 15 minutes. To avoid losing your work, please print or email it now. Thank you.
Awesome. So at any rate, yeah, 1980, huge efforts among our industry to reduce the number of fires. We've done a great job collectively over the years. The problem is, while our home fire raw numbers are decreasing, our home fire death rate is increasing. So let me put it another way. You're more likely to die if you have a home fire now than you were in 1980. In fact, based on the death rate for Texas, and that's per total population, our jurisdiction should be experiencing 1.2 fire deaths per year. That's why this is important. We are fortunate, and I will celebrate it like a pitcher celebrating a no-hitter. We are fortunate in that we haven't had a fire death in over 20 years in our jurisdiction. Some of that, let's just acknowledge it, is just dumb luck, right? But a lot of it has to do with, historically, the guys and gals on your fire trucks are really good at what they do. Some of it has to do with the efforts the colleagues that came before me have made in prevention, right? And some of it has to do with a responsive public. But those factors together have been really fortunate for us, and we want to keep that going. And that's why we're doing what we're doing. That's why we're targeting where we're targeting. So for us, next steps in this regard is we're going to continue our targeted efforts. We applied for and received another grant. We're extending this out to several areas within the jurisdiction that are highlighted based on their demographics and building stock profile combined. And then we're also seeking partnerships and relationships. Certainly this group, getting in front of Black Pflugerville, getting involved in various organizations, the Rotary Club, whoever, and just getting this information out there. And not just this, other topics as well that are of interest and of importance to the community. So, any questions on any of this? Yeah.
That was a perfect segue to where I wanted to take this. You described the whole like broader view of like risk reduction, right? And a lot of the data obviously is like backward looking, right? The stats on the different causes. I'm particularly interested and concerned with gun safety and gun deaths. I have, and I brought my stats, I was looking for them before coming here. Firearms are the leading cause of death for children and teens. I think that's a US total stat, but I know it's pretty high in Texas too. Every 2 hours, someone in Texas dies by a firearm. Now, a lot of that is suicide, so not necessarily. But, I think we all have heard on the news, there's been a loosening of gun laws, if you will, in Texas, which has led to more guns out there. And unfortunately, a lot of folks don't necessarily securely store them, which is resulting in a lot of children, that stat I just mentioned, right? Coming upon these unsecured guns and accidentally shooting themselves, shooting someone else, right, is an example of what we're seeing. So in that vein, I don't know if that's an emerging risk that you see as a targeted effort, because I think along the lines of like the underserved or the populations that are most affected by that type of incident, that's totally preventable. You know, it seems like an opportunity, and I feel like, as I've heard you speak and as I've thought about it, you all, as first responders, and particularly like as firefighters, seem like uniquely positioned to have the trust of the public in a way that maybe police officers may not. Not to say anything about our Pflugerville PD, love them, and you know, I think there's opportunities for them to engage the public as well, but you all seem like your efforts with the community, with the fire alarms, there's programs now where they distribute gun locks, right? Or educate about safe storage, right? It's not about taking people's guns away or anything like that. It's more about securing them so that these things don't happen.
Yeah.
And I'm particularly passionate about it. And you mentioned the large incident response, and I'm sure you all may have had a hand in it, but like my son was walking into Target in February this year when that shooting happened out there. So it's happening in our community, right? This risk.
Yeah.
So I don't know if there's anything you can say about any work being done there.
Yeah.
And if not, I just would leave that with you, that I think that, you know, the numbers, I think, are starting to reflect that phenomenon, and that seems like a good opportunity to
Yeah.
serve the public in this manner.
Well, I love your passion. I think that's how change and influence, you know, it just influences change in the community. I will say that we, at this level, have not seen the numbers that this is reflecting. But this is kind of big scale currently. Our next iteration, we can get a little more granular, and that will be a unique program to work in partnership with the PD. One of the key philosophies of risk reduction is multi-agency, like no one agency is the problem. That was our first iteration, and we didn't, and that was also kind of during COVID, so we didn't have the opportunity to really work with other agencies. This time we do, so I can't say that we will do it, but I agree with you. Like, we've got a unique trust that's built up over the years, and let's be honest. Some of that's just by the nature of what we do. You know what I mean? We come in, we help, we bounce. See you later. We make it better. And cops come in and take mom and dad to jail sometimes. So it's like, it's just a different function. It's not like they're bad people. It's just, goodness, this has been going on for decades. To know what we have correct. So I agree with what you're saying. We're very careful with who we position with and the organization we position with, knowing that we have, in general, the public trust. We certainly have some people that scrutinize what we're doing and don't dislike us, and that's perfectly fine. But in general, I agree with you. So landing the plan on that, definitely interested in continuing the conversation about it, because that is in our wheelhouse. If it is a risk, we want to do something about it, we have the capacity to do it.
So would you happen to have any, like, maybe information, data, or numbers regarding, like, I guess how many calls you answer regarding just firearms? Or any incidents related to it?
Yeah, we track gunshots. We respond to those regularly. But in terms of like, we respond to a call, and is there a firearm out there, or is a firearm present?
Well, more like an emergency,
Okay.
you know,
Yeah,
like a
yeah,
wound
we
or.
got that. Yes.
So, like, how's the data looking for that? Has it been generally steady, increasing, or?
So because of our population increase, our call volume goes up about 8 to 9% annually every year. So like when Dan shows the slide that fires are going down, nationally that is the trend, by proportion that is the trend, but we're responding to more fires every year than we ever have. And so I always try to make sure people understand that too. But our primary experience in nearly every category is going up, with the exception of false alarms, because Dan and his team have implemented programs to reduce that. But vast majority of gunshots that we respond to are either self-inflicted or homicide related.
Okay. I guess it might be on your next few slides. But I was going to ask about like what kind of troubles or challenges are y'all having right now? Because y'all are doing so much work, and we can't say enough that we appreciate all y'all do. And I guess the thing to say is like when y'all are doing things right, then people won't really think y'all are doing anything right because there's nothing serious, no emergencies happening. So I'm kind of interested in learning besides all everything y'all are already doing, what kinds of things that are either starting to concern y'all, or maybe you either haven't started looking into programs for that, or quite simply you're having trouble trying to address it.
What kind of things concern, if I'm hearing you correctly, what challenges are we having? Just
Yes.
so to make sure I'm clear, overall as a fire department? Or with this program, what's the scope here?
I guess just maybe the overall fire department.
Yeah, I think the theme of what we've been talking about here is just the growth. So Dan and his team review all of the plans for new construction that come into the community. So in the past 2 years, over 30 plans for multifamily housing. And so multifamily housing is great because I think it is part of the solution for affordable housing if it's done correctly. But what it represents for us is Dan's team has to approve plans for every single building in a complex. They have to go out and visually check every single building. And so 31 of those, just to put that in perspective, we only had 30 3 years ago. We're doubling that. And so we bring an apartment complex in, and you're talking about several thousand people being introduced in the community. But anyways, so there's an impact to Dan and his team for all of that work. We haven't doubled Dan as a team. We haven't done all that. It's just Dan working all the time and his team. Because some of this stuff ebbs and flows, right? So if we would have doubled our prevention team last year, we would have had to reduce them this year. So we just can't do that. Then that growth actually represents an impact to the operation. So the firefighters and the paramedics on the street, all of those people coming in have a demand for service, transportation, healthcare, and certainly emergency services. So we see that impact on the operations side. So I just think it's growth. It's just a challenge with growth. And ordinarily that's kind of a good thing for most communities. It is a good thing. But I always like to try to tell people that growth brings challenges. It brings a demand for more services. There is an extreme scrutiny from the public on where dollars are spent and where they go, and so that just kind of complicates it. And then stepping back, for us, me personally, working here since 1998, we've been dealing with an EMS challenge in Northeast Travis County, really all of Travis County. Travis County has a essentially rural-built EMS system that has been kind of unchanged for 30 years. The community has changed tremendously in 30 years. And so the need to look at that, to address that, that's what we're working through right now. And we're a fire department, but we go to all these calls. And so we're trying to really do everything. So I love hearing your idea that that's something I could see us integrating into a program we already do. Dan and I talk to groups all the time, and everyone wants us to do everything, and we want to do everything. And this guy probably will do everything if you let him. And so that's just what we're just tasked with. We want to do a lot of stuff, but we only have X amount of resources, and we have to be diligent where we put our resources. So I just think it's growth. I think the EMS system it is an issue in our community. We have a special interest group that is working to defund us. That is out there, and so we have these challenges. So that's what we're doing.
So could you elaborate a little bit by what you mean by our EMS service is 30 years behind? So what does that entail exactly?
So if we go back to the history of ambulance service in Travis County, we had about 11 ambulances 10 years ago, owned by Austin EMS, Austin and Travis County EMS. What that means is there are Austin EMS ambulances. The county pays Austin EMS to deliver those ambulance services. There are still 11 ambulances from Austin and Travis County in the county. So there hasn't been any ambulances added, and the community has exploded. So what ESDs have done is began adding ambulance service. So us and 2 other ESDs began providing ambulance service to answer the demand. We've done that through an additional funding mechanism called an overlay. And so that's an additional ESD that provides dedicated funding for ambulance service. And so that has solved parts of the problems in certain communities, but not every community. So the overlay did not pass in the city of Pflugerville and ETJ. Travis County picked up and invested to cover the ETJ. And then we have an overlay in the western part of our district. So that coupled with this, so that added 4 ambulances to the system. And then the city of Pflugerville contracting with a for-profit service has added 4. You take that into account with the other ESDs, we've doubled the amount of ambulances, but it's been outside of the county system because the county system is tapped out.
So what solutions are y'all looking at right now? Since I guess the previous vote.
Yeah. So for us, we offered at least one way to work with the city of Pflugerville, and that was through a subsidy. And so I think there's people out there that think that you can make money doing EMS service. And the only way you can really do that is to really cut your services to make it profitable. If you want to do a high quality service, you're not going to make money. You do go after insurance, so people who have insurance, who have Medicare, you're able to recoup some cost. And typically what is left over is what's not covered by insurance, what's not covered by Medicare, and what's not covered by people who can pay out of pocket. That's called a subsidy. And so what we put on the table with the city was cover the subsidy, help us out with the subsidy, allow us access to facility transfers.
The library will close in 15 minutes. Please take your final selections to the checkout desk. There will be no checkouts after closing. No new library cards will be issued tonight. If you need someone to pick you up, please call them now. Thank you.
That's a good one, Carter. So a way to do it is we need help with the subsidy and then give us access to the interfacility transfers, which means we would be helping the ERs who want us to help them. And that revenue could be used to offset that subsidy. And so we haven't ran that numbers because from where I sit, the doors are somewhat closed on working with the city at this point. We weren't successful in that discussion. But at that time, that subsidy was about $300,000.
Chief, could I just, I have background, a few years ago I was a volunteer when Chief first started. We actually ran a few calls together. One or two of them involved some reptiles, if I remember correctly. There's some stories there.
Yeah.
But I think as a paramedic and having been involved in emergency services for all of my adult life, the bottom line is when it comes to the provision of medical care in the emergency setting, I want to be clear, I'm talking about the emergency setting, it's not set up to make a profit. And the reason for that is you send people out to figure out what's going on and to help folks. Sometimes you transport them, which is where you make the money. Sometimes you don't, because they don't need it or they choose not to. But the point of it all is you want the best care delivered to the patient as soon as you possibly can. And that best care is a paramedic on an ambulance, on a fire truck. And the reality is, anywhere you go in a metro area, you won't find emergency medical services that are making money. There is a cost for providing that service, just like a cost for providing the fire department. And as a policy, we believe it's in the best interest of the community to have that service delivered to them based on a governmental organization, because if you've ever seen and gotten an ambulance bill from a private provider, it's hellacious. And I can say that in all honesty because many years ago I worked for a private provider. And now, set that aside, there is a role for them, and I don't want to be dismissive of private services. There is a role, because it's not our place to transfer someone from here to Temple, or it's not our place to transfer somebody from here to Galveston, or San Antonio, whatever. That's where your private services are really valuable, and they fill a very important role. But for 911 emergency response, the reality is you don't know what you have until you get to the scene. And that's where having that highest level of high quality care is so important to our community. to be able to deliver that. Obviously, you can tell I get a little excited about it because I've done this for so long, but I really believe that fire-based EMS, number one, there are studies that show it's the most cost-effective way to deliver that service. Number two, it allows us to do a better job of sharing, of allowing firefighter paramedics to have different roles, so you're not always stuck on the ambulance. You have a chance to work on the engine, you have a chance to work in other areas, and it gives them an opportunity to grow professionally as a paramedic. And that's the other, to me, real value is you have this professional growth, what the fire service can offer, which you simply don't have in a private service. And again, I want to be clear, I'm just comparing professional growth opportunities, not necessarily the quality of service. I know personally that for 911, fire-based EMS is the best way to go. And that's not because I'm with the Emergency Services District, that's based on 20 years as a paramedic.
No.
In 911, working in 911 services. So, all right, I'll get my soapbox.
Yeah, no, thank you for that. So with the city, I guess contracting private EMS service, has that helped? Like, would y'all say that's like been a positive for y'all, as in like it's lessened the amount, like by significant, statistically significant amount? Like, how has that impacted
So,
y'all?
On one hand, yes, we have 4 additional ambulances in the system. From a perspective of quality of care, from operational issues, to bad outcomes for patients, that has also happened. So to answer your question, having an additional 4 ambulances is good. I would rather do that a different way through a publicly funded service. But we've also taken on the lower quality and the issues that come along with the for-profit service. That's happening currently.
I think that was a really excellent point, what you said about, like, that efficiency aspect is lost. And I think likely because, and I've heard some of the discussions that have come up before around the ESD funding and all that, and it seems like the discussion gets sort of pigeonholed or hyper-focused on, like, emergency response, right? But to your point, like, there's other stuff you do.
So it's not, sorry, Chief. It's not about who gets there first or how long it takes them to get there. It's about the quality of care that arrives first. That's what's important.
Yeah.
Because no disrespect to all the staff that are EMTs, but there is a different ability to provide care as a paramedic compared to an EMT. And so if you're able to deliver, our ambulances respond with our, outside the city, they respond with fire trucks. So you're getting a paramedic plus 4 other folks, a total of 6 people showing up on a scene for a medical call. And that means you've got the highest level of care, and you've got a crew that works together, and you've got these folks that know how this patient care needs to happen. And that is so invaluable for the residents to get that high quality of care. And again, I'm not very good at being politically correct. I think the other thing that's really important is, as a resident, you're paying for that service through your ESD taxes, and you're paying about $120 to $130 a year on the average, for a house for that service, and you don't get a $2,000 or a $4,000 or whatever happens to be billed because you're paying your ESD taxes to begin with. And yes, that's a lot of money for a number of families in the community, but we believe that's way better than them getting a $2,000 bill from a private service, which will then go to collections, which will then affect your credit rating, et cetera, et cetera.
Yeah. Yeah, and when you're the one having to call 911 for your family, you'd be willing to pay almost anything at that point, right?
Sure, and again, I'm sorry, I want to be respectful of everybody's time, and we have a few minutes. The reality is, we provide care without regard to a person's ability to pay. They don't have insurance, they can't afford to pay for it. If you're living in an area served by the EMS overlay, you're paying your ESD taxes, which cover that.
Yeah.
You call one time, you call 10 times over the course of a year, you've paid for that. And so the point of all that is, for those folks that that are able to afford that $120, that's way better than having even one $2,000 or several multi-thousand-dollar bills over the course of the year. Because again, as Dan's data show, there are population segments that are at higher risk, chronic health problems, socioeconomic status, et cetera, that are more likely to call EMS. And again, we believe that providing that as part of our services inside the city is beneficial to the residents. We know it works well for the folks outside the city.
Yeah, I think the light bulb for me on the efficiency comment was, it's all of that. It's that quality, it's that reliability, plus all the other ways you all are prepared, like for a large scale incident or all these, traffic issues or whatever. So it's that and all the other stuff. And that's, to me, that's like the efficiency, right? That you all can serve in all of those capacities at that cost.
Thank you. Appreciate that. Sorry, Chief.
No, that's great. Robert and I, we responded to a stretch for a bunch of snakes at one time. And I'm terrified of snakes. And, anyways, once the fire was out, we went back in the building and realized what I was searching. I was putting my hands all over snakes and reptiles, and I would have had a heart attack if I knew what I was doing when I was in there. But the fire can't see, they're used to my face, and know technology, but that's what he's talking about.
All right. Like I said, Chief and I have known each other for almost 20 years now, and so we've had a lot of
May I have your
great
attention,
experiences
please?
together.
The library is closing. Checkout desk will close in 5
My
minutes.
staff.
Please complete
Is that
your
a
final
recording?
transaction.
No, it's a
There will
real.
be no checkouts after closing.
So he's
Thank
doing
you and
that.
have a good evening.
That's pretty.
Where did you
Yeah,
get
they
that
all have their own
from?
unique spin on it, so. Huh?
He's really good.
He is very good.
So do we need to get out of here and eat as well?
We don't have to if the commission has more questions.
I guess how much more do y'all have left?
Yeah,
Any other slides?
Wildfire segment. We'll
Yeah.
take very long.
Any other questions about what we previously discussed? I'll burn through this next stuff.
What's with all
Sorry.
these puns?
Yeah.
My bad. You guys remember this? Anybody here? You guys remember this
Yeah.
famous, almost
Do you
iconic
want
picture
to leave
locally?
some of these for,
All right, yeah, that's
yeah.
Bastrop burning off in the distance. I was here working with county fire marshal at the time.
Thank you.
And so we were one of the several fires in the area that we experienced a day, 3 major ones here, and several out in the west part of the county. And on the tail end of that, we do damage assessments. And so as part of the FEMA recovery program, you get FEMA funds, you go out and you go house to house in these neighborhoods and say, okay, well, this is minor damage, you just talk about the scope of damage for each actual address. And so I was doing damage assessments in the western portion of the county, and it was often that I would be filling out the paperwork and I'd walk along, homes destroyed, significant damage, moderate damage, no damage. And it was mind-boggling to me as a young investigator and being a little bit younger in my career, and looked similar to this. I mean, it was as dramatic as that. But the more we study this and the more we learn about wildfire and who it impacts, we know that there are some things you can do. And people talk about this wildfire as it's a natural disaster. It is natural, it's a disaster, but that kind of implies this passive victim role, that terminology, right? And that's not necessarily the case. You can influence what happens to you, your home, your loved one, in your neighborhood, because we are all connected by what you do in your home. So real quick, these 3 factors determine how bad a wildfire is going to be, weather, topography, and fuel. Weather and topography we can't do anything about currently. The weather is terrible and ripe for a crazy wildfire. That's a concept of temperature, wind, and humidity. We're in a high risk temperature factor right now. Topography, which way does the land, how steep is the land, which way does it face? That's called aspect. That's boring. And then the fuel, what's actually burning. So depending on those factors, fuel, topography, and weather, that will determine how bad a wildfire is. And in 2011, they all came together in just a spectacularly disastrous way. I want to call out the primary method of influencing how bad a wildfire is you control the fuel. Clearly, you can't do anything about the topography. You can not live on a sloped area, but you can't change it. and you can't change the weather, you can't change the fuel. And so that's what we want to talk about now. Chief, you want to take us home?
Yeah, just, so obviously, y'all are tracking what's going on right now. Dan's referencing 2011. We're right at where we were at. 2011, we're actually worse. The only thing we haven't had is a significant wind event. On Labor Day 2011, we had 40-mile-an-hour winds coming through the area. If we were to have something like that, we would very much be probably worse than 2011. What we have right now is just understanding fire risk in Travis County. We're the number 6 most at-risk community in the United States. All of the other states, all the other areas are in California, and then there's Central Texas. And so here in the northeast part of the county, most people are like, there's no forests in Pflugerville, but what there are is light flashing fuels rolling very good in agriculture that burn and burn very fast. A lot of fatality fires for firefighters and civilians occur in that environment because the fires move so fast. So what we have here is we have a combination of drought, which Dan was explaining that previous slide, we're in an extreme drought situation right now. We've had significant 100-degree days for a long period of time. And so then you add in the weather, things like wind, and the dropping of humidity. All of that comes together, and that's what we're going through right now. So currently, we are running twice as many fires than we did in 2011, but we're able to control them because, like I said, we haven't had that wind. And so all of the fire departments are bringing on extra staff. We've been staffing in overtime for going on 3 weeks now. That costs us about $30,000 a week to do. And we're obviously helping our neighbors. And so you may see Pflugerville fire trucks going all over the place, but that's so when our community catches on fire, all of those people are going to come help us, and they have in the past. So like Dan said, in 2011, we burned over 300 acres, 2.5 homes, over 3 fires. I was working that day as the incident commander for 2 of the fires. Craziest thing I've ever seen in 25 years. So that's what we're dealing with right now. Like what Dan said, what can you do? We've given you a home wildfire action plan. It's on our website. It's throughout social media and the news right now. And really what this is just some basic concepts. We like to say have a plan because that applies to all disasters. That means knowing how to receive emergency communications. So one in Central Texas, Civic Plus, which is the city's notification system. And then having a kit, a backpack with some supplies, and then knowing how to grab your pet's pills and family and to go. And so that's what we're communicating. The other part about it is you can clean your house up. And you can do this to very extensive degrees with cleaning and enhancements to your home. Just really cleaning up vegetation around your home, like Dan was saying. You've probably seen this picture of the house in Maui as well, or if you haven't seen that. There's a picture where there's the destination of the construction in Maui, but there's one freestanding house. It had a defensible space and it had the construction elements to harden your home. So those are some things that we can do and that don't take a lot of work and take a lot of money that most people can do. So that's kind of a big message we want to leave everybody with on the wildfire topic. And so we're just praying for rain, lots of tropical depressions sitting out there, and at some point it's got to change. So that's kind of where we're at. Otherwise, it's just making sure everybody knows 9 out of 10 wildfires are started by human activity. And so it's things like improperly discarded cigarettes, cooking fires, not securing in chains, not doing hot work in the appropriate manner. So what we call hot work is welding, cutting, doing things outside without taking the proper precautions, which means looking for things that can catch fire, having a water source or extinguisher.
Yeah, so on the fuel topic, like we're talking about control what you can control. Look at your house as a fuel source. And you want to look at that immediate area around your home. And that's that area from your outside wall, about 5 feet around the curb. What can burn? Clean up your debris, clean up your litter. If you want to change some mulch from combustible mulch to rocks, that's advised. Keep your bed vegetation away, remove the trees, clear your gutters, clear the alleys of your roof. That's simple stuff. That's an ask for during this time. That's an easy thing that you can do this week. I got it now. Controlling fuel.
Should you not be cooking outside?
Probably not a good idea now. I mean, I still cook. I have a gas grill, so I'm not producing charcoal or ash or stuff thrown away. But it's advised, and I think it's even illegal in some of the Travis County parks currently, particularly with poles or wood fired appliances. Yeah, so it is extremely dangerous right now. I think the Mayor Kurt Watson said, don't cook, don't even use gas grills. And I was like,
Oh, yeah, that, I was wondering, because we have a gas grill.
yeah.
We use it
Yeah, gas is
weekly.
definitely safer. Like, majority of fires we see started from barbecue pits are going to be coal and wood related. We see very few propane fires.
Yeah.
I've seen them, but they're getting there.
Thank you for clarifying.
Sure. We kind of went through all this. There you go. That's us. Contact information.
Oh, great.
Some pictures. And just really quickly, we're going to leave you with some resources. I'll look
Great.
through
Thank you.
what we have here. This is our annual report. This is great information there. Also our smoke alarm hotline. If you have any questions about smoke alarms, we do provide them for free. Qualifying has to do with, can you afford a handyman? Can you get on the ladder by yourself? The answer no, those are going to come out. And there's some great data there about some of the fantastic things our guys and gals are doing. Cooking fires, I mentioned the one cooking type, and the one fire type in our jurisdiction. So there's some data on cooking safety, on smoke alarm placement, and bush wildfire action plan, which we go over those concepts that we mentioned in a little more detail. And then, please, in the back there, if you're interested, we have some giveaways, like swag.
We always like giveaways.
Yeah, we have some little first aid kits, Band-Aids, little antiseptic wipes, and some basic stuff to keep in your car. It's good for the small stuff.
Nice.
Thank you all so much. Sorry that went long.
Thank you.
We'd love to
Thank
spend more time talking data and numbers. Yeah, do that anytime.
That's
All right.
kind of cell phone. If you ever don't hesitate calling me.
Oh, thank you all again for,
Thank you so
you know,
much.
for all the information and everything.
And thank you for everything you do, putting your bodies on the line.
Yeah. So,
But we're excited about equity commissions too. This is, I know you're relatively new, but it's a cool thing and we're excited about it. So anything we can do to help, think about us, look for opportunities, integrate us, we're all about it.
I have ideas.
ah, good.
We're
Yeah.
at the end of
Thank you.
Yeah, I hope we can start I guess a conversation about what else that we can do. There, I guess the last question I can ask, so we don't keep too much of everyone's time, but like, is there anything that comes to mind for like what can the city possibly do or work with y'all with to prevent, you know, in regards to like fires, wildfires?
We've been talking about, we would love to see a partnership with the city on the smoke alarm program. We're doing a lot of work in Western Pflugerville, and I know there are people in the community that are asking for services in Western Pflugerville, which is the older part of Pflugerville. We're already doing that work, so it's like, hey, city, let's work together on this, because the city has advertising components. At one point, we had staff that when they heard about this, they're like, how can we help? Anyways, so I think that's an opportunity we'd love to have some working together on that, because it's kind of a natural fit.
Yeah, for sure.
That's just one example that I know that we've had been talking about in the past.
Yeah, we're dusting off some ideas. One thing I think about is emergency management. The city has an emergency manager, Jason Hahn. You know, I think we have an opportunity to work more with them, shore up our plans, and make sure we're all on the same page in regards to who's going to do and how we're going to respond. And also messaging, right? Like, so I think something as simple as consistent messaging between our organization and the city to make sure we're telling people to do the same thing. Because what we hate to happen is there be an ice storm, and you know, we're giving people either conflicting or confusing information. So for sure,
Right.
we are expanding in that regard, for sure.
So do y'all have a consistent communication with Jason Hahn, or is it just still?
We do. I talk to Jason regularly. I'm actually going to a meeting with him on Monday that we invited and made happen. So we're meeting with several emergency managers throughout Travis County on Monday to talk about all of our.
Yeah.
Jason, I don't know if y'all know, Jason was a Navy SEAL, so we're all like,
Oh wow.
we just kind of we were all moved by him. But yeah, we communicate with him. He's great. We really like him.
Our next version of the CRP, there's a flood component. We recognize we have a lot of low water crossings. We had several near misses recently. And it's also incredibly dangerous for our first responders. So I think that's also a natural tie to work close with the city and identification, maybe perhaps some engineering strategies to to reduce the risk in those flood-prone areas. So that's something that we're going to be exploring as well.
Yeah, that's actually really interesting. My wife's an engineer and she handles, like, she does a lot of work on like water resources and everything. And she's been telling me, like, over, actually she likes to talk about it a lot, just like how our floodplains, our flood maps, are kind of like, they're not consistent, and the consistent messaging. And so there's a lot of things that are lost in translation or treasure hunting in a way. And so I guess I'll have to talk to her more about it and see what we can do to help you all.
Yeah, for sure. Well, like I said, we realize we have limited scope, limited ability. We're going to have to partner with as many organizations as we can on some of these topics. So we will be getting creative in that regard.
Okay.
I have a question. The board commissioners, I'm seeing everybody's lovely pictures, including Mr. Turner here. Are those paid positions or your volunteer
We
board
get stipends,
commissioners?
but we're community volunteers.
So you're not getting rich serving in this commissioner
Oh, no.
capacity?
Oh, no.
And I
It's
didn't
like-
think you were, I just thought it was
No,
important to
it's like
highlight that.
Tonight, we get a stipend for attending board meetings and official meetings that
Education.
the board calls. But like tonight, I'm here on my own time because it's important for us to reach all the community. And I say all the community because I recognize, again, drawing on my experience, how important it is to reach those folks that are underserved, underrepresented. And so for me, to see this group start and try and have some impact on that, I think is super cool because I know how beneficial it is when I've been on the scene and I have a female partner or I have a partner that's of, a
Community.
disadvantaged group and we're at a residence of somebody who's disadvantaged. And having that person there that can connect with that family, it's just amazing. Until you've experienced it and seen it, I can't explain it really well, but to me, it's hugely valuable. And so, what y'all are doing, I think, is really great. And that's why I'll run this just a little more. I'm super excited about the civilian program because we have done amazing things for the diversity in our department since that started about 3 years ago. And having our department reflect the members of the community that they serve, to me, is one of my top priorities.
Thank you so much. And I'll reiterate it again then, the efficiency point, right? Like you're saying, you're here on your own time.
And Chief's not getting overtime for being here, and neither is Assistant Chief.
Yeah, you don't get into this business to get rich and do it because
Yeah.
you want to do it. And a really cool thing about commissioners, ESD commissioners, is the statute actually kind of impresses upon the county court to appoint people who have backgrounds in emergency services. And so you get expertise at the board as part of the law. And you don't really see that in really other parts of government, but certainly for emergency services, it kind of makes sense because it's a big responsibility
Yeah,
that these five folks carry.
gotcha. Thank you.
Yeah.
Yeah, I'll just kind of piggyback on that. It sounds a little corny. I admit it. I used to shy away from it when I was a firefighter, but that's been on our pins, that's been on our shirts, that's been on our publications since the inception of the fire department. It's because we care. Like Chief said, this isn't a money focus or financial driven reason to get in here and do the things we do. No, I'm not complaining. I get a healthy salary. Thank you guys. But we do it because we care about our community deeply. We want to make a difference. We all got in this job because we wanted to go in and make a difference in people's lives, regardless of what they look like, regardless of who they voted for. We just want to help. That's all we want to do, period. And it's primarily because of care. So just wanted to throw that in there.
Yeah.
Any other questions?
Yeah. Once again, thank all of y'all for coming here and giving your time and expertise. There's so many things. I hope that we can, use this kind of like as an opportunity to possibly maybe ask more questions later, maybe through emails. We have y'all's contact information. I'll probably maybe ask y'all a little bit more, maybe not today because we're, it's pretty late, but I was going to ask about like the opioid or fentanyl, since we spoke to, I think about last year, we were talking to, a judge, a county judge, and now they were talking about how it's, kind of already here and encroaching, and so I hope we can start more of a conversation about that down the line.
Yeah, we're well positioned to do, like I said, carry it. You have a doctor who can prescribe it, you can get it out. There's ways to pay for it, like the judge is well aware of. And so, yeah, we're good.
All right, thank you.
Thank you.
You're welcome. Just, I'm speaking for the chiefs, but I'm sure 6 months, 8 months, we'll be happy to come back and give you an update.
Yeah,
Some more questions?
those numbers for our makeup of our fire department will keep going up. And I promise you that. We're working really hard with that, and we're proud of that. So, nothing else. I'll give you those updates as they come.
Thank you. We appreciate it. Okay. So
Thanks
that's the
for
last
having
one.
us.
Of course.
Thank
So with that being said, I guess I'll adjourn our meeting. So it looks like it's around 12, 13, 14.
8:14.
8:14.
14.
8:14.
8:14.
Like it's
Yes,
not 9, is it?
8:09.